I just want to read something on your website from when you came into politics. You said that it was because you were concerned the state that the NHS was left in by Labour. Do you really think that the NHS is in a better state 14 years on?
But I think we've just come through a global pandemic, which every country in the world has experienced pressures on their health service as a result. And if you look in Labour-run Wales, their waiting lists are growing, where ours are coming down. Over the last 6 months, we've seen 200,000 people come off our waiting list, and that's because we're opening new surgical hubs, new community diagnostic centres, and we're getting elective recovery plans in place. Now, in my local area, for example, under the last Labour government, they were going to close both Eastbourne Hospital and the Princess Royal next to me, and that's why I got involved. I was a nurse working in the local hospital and knew that we would never cope. Now, we have saved both of those hospitals, and they're now getting improved infrastructure as a result. And some hospitals which were invested in under the last Labour government were done so under PFI deals with private finance, and they're having to pay back extortionately high rates of interest even today as a result. So, we have invested in local services. It has been a difficult time for the NHS, but your graph was a little bit misleading, because if you look at the latest figures for the last 6 months, our waiting lists are coming down, and that's why we're investing in more frontline services to get them down even quicker.
But since 2010, we've seen, even before the pandemic, waiting lists for hospital treatment nearly doubled, and that was from 2010 to before the pandemic. So I think it's hard to say that the Conservative record's good.
Well, it's not how many people are on the waiting list that is the important factor, because as we develop new treatments, as we open up new services, as people get conditions that can be treated, waiting lists, of course, will grow. More people will be waiting for treatment, but it's how long they wait. This time last year, people were waiting over 2 years because of the COVID backlogs. It's now on average 16 to 18 weeks. So that's a significant reduction. The same cannot be said in Labour-run Wales, where the waiting lists and the waiting times are increasing. And so, Labour say they have a plan for the NHS, but where they are responsible for it, actually they're seeing a far worse performance in their health services.
Last year, 40% of patients waited more than 62 days for treatment after an urgent GP referral, compared to the target of 85%. I mean, I guess on a personal level, you came into Parliament because you were a nurse, a cancer nurse. You know firsthand the impact that late diagnosis can have. How do you feel when you think about those statistics? Obviously, it's not good that many people are waiting for cancer diagnoses.
If you look at the actual outcomes for people, we are now seeing better outcomes for cancer treatment and survival than we were 10 years ago. If you look at cervical cancer, for example, we're on the brink of eradicating that with our HPV vaccination programs, where we vaccinate young boys and girls in school, and then they don't go on to develop things like cervical cancer. That's a game changer. If you look at the work we're doing with our prostate cancer screening, we're about to announce the recruitment for the Transform trial, which is the first ever screening program for prostate cancer for men, aiming to get those men diagnosed at a much earlier stage. If you look at the work we're doing on lung cancer, we are now diagnosing with our lung screening system. Nearly 80% of lung cancers are stage 1 or 2. Previously they were all stage 4 and very, very hard to treat. So it isn't just about the easy statistics that you can pluck out of the air in terms of how long people are waiting. It's the outcomes that matter. And for hard to treat cancers like lung cancer, we are seeing, people being diagnosed with stage 1 or 2, which is treatable, whereas that was not the case a few years ago. So we do need to look at the wider picture when we have these discussions, particularly around cancer care and treatment.
I understand that money has been spent, but, we're not just plucking figures out of the air. These are what the graphs show, and it does matter how many people are on waiting lists. We've seen that pretty clearly. I guess it's also kind of a question of trust. At the last election, the Conservative pledged to build 40 hospitals. That hasn't happened. It doesn't look like it is going to happen. Why should people trust that these new GP services are going to be built?
Because we have built and opened over 100 surgical hubs. We have built and opened over 100 rapid diagnostic centres. And it's those centres that are getting people diagnosed earlier with
your
CTs,
promise on the number of hospitals that would be built. I mean, that was
So
a
no,
pretty.
we said no. Actually, the target for those hospitals is by 2030, and we're not at 2030 yet. That was in our
But the
manifesto by
the
2030.
NAO say that you won't be able to do it.
Well, that is the pledges by 2030. We're not at 2030 yet, but what we have opened is over 100 rapid diagnostic centres and 100 surgical hubs, which are getting people diagnosed earlier with CTs, MRIs, X-rays, and then getting them treated much more quickly. That's why we were able to meet our cancer waiting times last month. It's why we're able to meet our A&E waiting times as well last month as well. That isn't the case in Labour-run Wales. And I'm not saying that things are perfect in the health service. I know from my own constituents that they struggle to get GP appointments and have longer waiting times that we want. But we are making progress on those. And when we're starting to diagnose things like lung cancer at a much earlier stage, when we're starting to eradicate things like cervical cancer, we are making progress in the areas that matter to people. And for my constituents, it's how long they're on those waiting lists, not who else is on that waiting list with them, that really makes the difference.
Okay, I want to ask you about Rob Burrows, who has died this evening at 41. Can we get some reaction for you to that sad news?
Yeah, no, it's absolutely devastating. And, he was such a champion to shine a light on his condition. And, again, that's why we do need this research and investment into new treatments and earlier diagnosis for conditions such as his, and why we're investing in so much into research through the National Institute of Health Research. We have to do better with these conditions. And he's such a kind of a hero and role model for so many people. And it's very, very sad news indeed.